is provided to people for medical.
You don't have any concerns about premiums going up?
I think if we can bring choice, selection, and competition back into the non-group policy market through this tax credits, and that premiums will go down and deductibles will go down. You know, it doesn't do any good to have low premiums. The deductibles are so high that people can't use the insurance.
You say you think it will, but what is the confidence level? Because there is a slew of analyses, and you know that they're out there, that suggest the exact opposite of what you're saying. And in fact, those who would be hurt the most are those who would in fact be those who have the most difficulty: the poor, the elderly, the people most in need of the help that Obamacare provides.
Well, see, we need to focus on the two distinct aspects of the overhaul. One is the insurance for people that will buy the insurance that people will buy through the tax credit program, who are above the poverty multiplier, and then there's the Medicaid reform. Both are two distinct issues, and both, I think, have favorable outcomes under the House bill.
If the CBO score comes out on this Senate bill and suggests the same thing that the CBO score on the House bill showed, which is that millions of Americans would lose their health care under this bill, you still would support it?
Absolutely, I would. Remember that the voodoo economics of the CBO score was faulty the first time around, and the Wall Street Journal covered that very well. You know, it assumes that nobody will buy insurance unless they're mandated to by a statist system like Obamacare. It doesn't give any credit for behavioral modification and incentive through the tax credits. It also does not take into account the ability of governors to lead and redirect Medicaid in their states the way Medicaid was intended to be, as primarily a state-oriented benefit with some subsidy from the federal government, not vice versa.
You cite the Wall Street Journal. Let me cite the Center on Budget and Policy Priorities, which says this is basically a program, a bill that makes sure that the wealthy get tax cuts. The savings, a lot of it is expected to go in this bill toward tax cuts. And in fact, what the Center on Budget and Policy Priorities found is that $7 million a year is the tax cut a year that each of the 400 wealthiest families in America will get as a result of this. That's okay with you as people are losing their coverage?
See, I happen to think that tax cuts on it to stimulate investments, which is what this tax cut is. It's Obama put in a tax on investments. Cutting those taxes are very important to stimulate investments and job creation. I mean, sometimes these people don't seem to understand how capitalism works. When you incentivize investment, people deploy capital, create jobs, build companies, and put more people to work so they can afford all these things and not have to be on Medicaid.
Well, we're talking about tax cuts of $7 million for the 400 wealthiest families, but I want to ask you about the other thing that people are sort of itching to talk about, if I can, and that is it possible, and I know that a lot of Republicans are waiting for this day, that Anthony Kennedy might retire. We don't know if it's going to happen. There have been a lot of rumblings. I'm told you had dinner with him recently. Did he seem like somebody who was on the verge of retirement to you, Congressman?
You know, yeah, my wife and I had dinner with the Kennedys at an event last week, and we sat next to them. And I've got to tell you, I hope I have half the mental agility and physical agility and perspicacity that the justice has if I ever get to be 80.
Well, I think if you use the word perspicacity at 9:43 in the morning, most people would say your mental agility might just be okay. He didn't talk about retirement at all at that table?
No, he didn't. He was talking about a lot of cases and just he's got a great sense of humor, very witty, very much alive. I also sat next to him at the Friendly Sons of St. Patrick dinner back on St. Patrick's Day and had a fantastic 3-hour visit with him.
Well, Congressman, thank you so much. We will see what happens with the Senate health care bill and what may or may not end up back in your house. Thank you so much.
Thanks, Chris.
Up next.